Good morning, everyone. This is Mary Funseth. I'm located in southern Wisconsin. I'm part of the quality improvement organization, Metastar, and Metastar is a part of Superior Health Quality Alliance. I am a quality improvement advisor with Superior Health Quality Alliance. I see folks are just starting to jump on the call, so we will work towards our presentation here in just a moment. You have arrived to the regional COVID-19 all care setting call, focusing on fostering resilience. Next slide, please. As many of you know, because you've attended many of these calls, we are together today because of Superior Health Quality Alliance. It was formed back in 2018, bringing together the quality improvement organizations of the 3 states of Minnesota, Wisconsin, and Michigan. And then we also had joined with us the hospital associations from additional states, as you can see there. And together we formed the Superior Health Quality Alliance. And together we are working towards achieving the goals that CMS has created and has asked us to attend to. And with you, we hope to share resources as well as hear about your expertise in the coming months and next few years. Next slide, please. So we want to remind you, as per usual, please mute yourself when you're not speaking, and then remember to unmute yourself. Know that you can do this by pressing *6 on your phone if you're calling in. But if you're simply using the Zoom app, you can mute yourself on your screen. You may show your video if you'd like. And if you'd not like to do that, that's fine as well. Your names are showing, that's great. We want to let you know that our chat box is being monitored today by Nikki Kamer, and she will answer questions to you via chat. And we will also take a look at that chat when it comes time for questions. As you have questions, feel free to put them in the chat because we can monitor that and bring that forward to John when we have moments that we are pausing for questions. I also wanted to let you know that Jill Hansen, another teammate from Metastar, is on the call today with us, and she is going to sort of monitor that technical assistance as well. She shows up as Superior Health as one of the attendees. So I would like to now have John be ready to step forward. We're going to go to next slide, please. John is here today to help us recognize the importance of resources to maintain resilience, identify methods of fostering resilience in yourself and staff. John Glover has a long history as a mental health provider. And he, after many years of providing services to patients, he came to Metastar, and now he is providing guidance as a subject matter expert, as well as a quality improvement advisor, project specialist within Metastar, working on a variety of tasks there. He's going to guide us through some personal reflection today, but at the same time, he's going to be sharing with you a number of resources that will help you, help yourself, your staff, your family, your friends, your coworkers, the folks that you work with, meaning the consumers, the patients that come to you. So with that, I would like to hand it over to John Glover.
Thanks, Mary. I have to say I got a chuckle. I do have a long history, right? So,
you do.
For those of you who don't know, I've been about 30 years in mental health and substance use treatment as a psychotherapist. The last 17 years with the University of Wisconsin Department of Psychiatry before I came to Metastar. So Mary's right, she's on target, long history. So appreciate that. So you can see our objective here is to share some resources on resilience. And so in an effort to do that, I thought I'd like to start off with sharing some things with you about, sort of where I am today. I've seen people's faces this morning, whether it's colleagues or familiar people that I've met here in town and have joined. It was really nice to see that. And I also see some other folks' names in the list of people that I know and have worked with in the past. And it's just really heartening to kind of reconnect in some way with all those folks. As I listen, and hear, kind of what's going on around me today. One of the interesting things, that I'm kind of hearing right now is some crows outside that are just doing that familiar caw, caw, caw. And it's something that, you hear crows, it's always those three calls, right? And they're so distinctive. So they seem to be kind of circling around outside. And I'm also kind of feeling, and grateful for the heat blowing into the room this morning, keeping me warm. For a while, when we started this sort of working from home stuff that a lot of us are doing, I was in the basement and it was a lot colder, but I've been fortunate to be able to move upstairs where there's a little more warmth and a little more direct access to heat. So just kind of noticing all those things that are going on for me this morning. And I'd like to take a minute to really appreciate all of you for joining us today. Being here with colleagues and other people who are working in healthcare and so many different facets of it. It's just really a joy for me all the time. And it's one of the things that I really love about my work is whenever I get the opportunity to work with other clinicians. Having been a clinician for a long time, there's something about the opportunity to talk to other clinicians and other people in the healthcare field who are doing work trying to help, our patients and those people in need, that it's really energizing for me. And it's just one of my favorite parts of the work. So I really appreciate you all being here. And I want to say that for all of you who are doing this work, I'm really so grateful for all that you're doing to help us in this very difficult time. You get up every morning, it's busy, you probably have families, some of you have children to get ready. And yet you get up and you do it and you get prepared, whether you're going out to an office or whether you're, going to be working from your home environment. But you put that effort in, and no matter what your role is, it's impacting the care that our patients receive. So I really want to thank you for the effort you make each and every day to make sure that this happens. So let me invite you to do a few things with me this morning, and it's all part of the process here. So hopefully you can join in. If you choose not to, that's fine if you got other things that are demanding your attention, but otherwise, join me for a few minutes here. I'm going to ask you to do your best just to slow down as much as possible and let yourself be present right here for just a few minutes. As best you can, let me direct your attention to some very simple tasks, and there's nothing else that you need to do for the next few minutes. Then join me in noticing just a few things together. So first of all, I'm going to ask you just to simply put down anything that you're holding in your hands. Take your hands away from the computer keyboard if they happen to be there, or if you're holding something, in them. Just allow yourself to put that down and notice when you took your hands away from the computer or put things down, where did your hands end up? I don't know about you, but for me, they ended up in my lap. But if for some chance yours didn't end up there, let them rest wherever they ended up. If it's in your lap or on your thighs or knees or, wherever it is, in a way that's really comfortable for you, just kind of let them relax and rest there for a minute. And just notice your hands kind of being softer. And then next, I'm going to ask you to notice your shoulders. See if you can notice any tension in your shoulders. And then see if you can just release it a little bit and allow your shoulders to just kind of relax and drop down away from your ears. And sometimes it's helpful to coordinate this with breathing. So if it's helpful to you, the next time you inhale, just kind of use that inhale to bring your attention to your shoulders. And then as you exhale, just gently allow them to drop down and relax. And you can do this a couple of times if you're feeling, like it might be helpful. And then, maybe with one of your breaths, see if you can't let that relaxation go all the way down into your hands and just kind of let your shoulders and your arms and your hands relax. So hopefully we've slowed down for a minute from our busy lives, right? So let me reflect with you on some things and ask you to join me in a couple other activities here. When I began the day, I noticed with you some things that I was seeing and hearing and feeling when we started the meeting. So I'm going to ask you to take a moment and do that for yourself right now. Just notice something, that you're seeing, hearing, or feeling. It doesn't matter really what it is or what your focus falls on. Just let yourself be really aware of that particular sensory experience. What do you see? Or is it something you're hearing, or is there a feeling you're having? And again, just kind of let your breath, take a deep breath and just kind of notice that for just a moment. The next thing I did with you was I shared with you something about my job that I really liked. And what I'm going to ask you to do is do the same thing for yourself right now. As best you can, reflect on one thing about the work that you do that you really enjoy. And it doesn't matter what it is. You don't have to rank it as best or most or anything. Just whatever came to mind when you thought, what is it that I like about my job? And kind of imagine yourself, experiencing one of those moments. And just let yourself hold on to that memory or that thought just for a minute before we continue. And then the last thing I did was I talked about something that I was grateful for. And so you probably already guessed that's the last thing I'm going to invite you to do. I want you to simply notice the first thing that your mind goes to when I ask you, what are you grateful for today? And again, you don't have to rank it. It doesn't have to be the most grateful. Just, something that comes to mind. And just take a moment and let yourself feel grateful for that aspect of your life. And recall a moment when it was happening. So I'm going to ask you to just bring your attention back to your breath for a moment. Notice the breath going in and out. And we're going to talk a little bit about the topic of resilience and what we've just done together. So what we've just done is several examples of techniques and approaches you can use to help yourself manage stress and get through difficult days or difficult times. They're actually all well researched, but I'm kind of hoping that the experience you may have had this morning was sufficient to convince you, instead of me having a bunch of slides with research studies and data and numbers and percentages that we see all the time. I was sort of hoping that just taking a few minutes to experience those things yourself might be helpful to you. So the first thing we did was we took a moment to slow down and relax. And I'm sure you all know the importance of relaxing to manage stress. But hopefully today you notice that it actually doesn't have to be a long time consuming practice, just a couple of moments to notice the tension that might be in your body, and relax, take a breath or two. I actually used to work with a pediatric nurse who would tell people about a small device she had working with newborn infants that provided them with a single deep breath to help calm them down. So it really doesn't have to be a big technique or long process. Just take a moment. The next thing we did was we noticed our sensory experience. So, this is a great way to kind of get out of your quote unquote thinking brain, is just draw your attention to something that you're seeing that is pleasing. It could be a scene outdoors or a picture in your house or in your wall, whatever. Could be something you're hearing, like I was listening to the crows this morning. Or maybe just the warmth of the air and being in the space that you're in currently. It doesn't matter, but just kind of noticing that sensory experience to get out of thinking and get into your body. And then we focused on something that we enjoy. And that can be really important because you may or may not know, but the mind tends to focus 5 times more frequently on negative thoughts than on positive thoughts. So it's actually really important for us to intentionally ask ourselves, what's going well? And what do I really like about what I'm doing? So keep that in mind. Take some time to intentionally acknowledge and recognize things that you are enjoying. And then another thing we did was we took a moment to be grateful. I probably don't need to tell you about all the research on gratitude and how useful that is. It's pretty well known at this point that practicing gratitude can make a huge impact on your life. One of the interesting things about it is that we kind of hear it and then we go, yeah, we know that. And then we don't necessarily do it. So it really takes intentional practice. And if you look at some of the wisdom traditions, they're practicing gratitude is throughout them, whether it's when you get up in the morning, or for many of us, it's before a meal when we are grateful for the food that we're having. And for a lot of people, people I've worked with in recovery, it can be something they do at the end of the day, in the evening before they go to bed. They're thankful for another day of sobriety. So if we look at all of this, what we did was, and you may have noticed this, we actually were doing a little bit of mindfulness practice. And I just wanted to do that to kind of help you see that mindfulness can be just as simple as taking a few moments to be present and notice without judgment what's going on for you. And taking a few moments to take care of yourself in that way. So it doesn't have to be complicated. It doesn't have to be formal. It doesn't have to be long. Just a couple of moments of maybe a single breath and with some intention, just to be mindful, can make a big difference as you go through your day. So there's one final thing that I'd like to add to this that we've done today, and that is I'm going to encourage you to consider practicing self-compassion. That's right. Try to be a little more understanding and forgiving of yourself. When you notice that you're being hard on yourself, or maybe beating yourself up for something that you think you didn't do well or could have done better or something, try to be a little bit more forgiving and have some self-compassion. Recent research, again, I'm not going to bring it out to you, but research has shown that practicing self-compassion can actually reduce inflammation in the body. So be kind to yourself, not just to others. All right, so hopefully that's been somewhat helpful to you this morning, and I appreciate you taking a few moments to sort of reflect on those things with me. I do want to go ahead and share some resources that I know you're perfectly capable of looking up and looking into yourself. So if we could have the next slide, Jill. Thank you. In regards to resilience, we've got a couple of things here. The first one is a really interesting article by a researcher in Australia, Dr. Michael Unger. He's been researching resilience for several years. And he points out, this is just a brief article, but he points out the correlation between having sufficient resources and being resilient. So if you're interested in sort of social determinants of health and how that impacts resilience, he's got a really great article there. Actually, I'm going to share one of the things from the article, just a statement from the article with you to give you an idea. He says, it turns out that personal traits like grit and perseverance can only take you so far. To succeed and overcome obstacles, you need far more than that. The environment and around us and the resources we've been given play a huge role in whether or not we're successful. Grit and individual motivation is one thing, but it's not usually enough to create change. You need an environment that makes it possible for you to change and grow. So really invite you to take a look at that article. Very interesting stuff. And then the next link there is to the Resilience Institute. And I'll say that there's a lot of stuff on that particular website that's really great. Some of it is things that, you know, they're selling and that you could purchase. That's completely up to you. In the quick links there on the slide, we put a link to the articles and interviews that are free. And there are other things on that site that are free. And then, like I said, there's some things that they are, you know, that are for paying. But there's a lot of really nice information that I think you'd enjoy on the Resilient Institute website. And then if you all haven't been to the Resilient Wisconsin website, it's actually quite good. I have been very impressed with the work they've put into that. If you go to it, you'll see that they have a lot of resources on trauma and trauma-informed care, social determinants of health, adverse childhood experiences, just really great stuff. And if you go into each of those areas, they've got links to all kinds of different articles and resources on each one of those. So I'd really encourage you, if you're looking for some information, they've actually collected quite a bit of really good stuff. All right, so next slide, Joe. Thanks. So in terms of social determinants of health, as I said, Dr. Unger has kind of put resilience and social determinants of health together. But the first link we have here is to, again, a short article. And this article is from the American Academy of Family Physicians. It's a great article, really short and sweet, and yet it incorporates sort of the three main social determinants of health approaches that most of us may be familiar with. The screening tools there, we have links that go directly to those, and they're also included in this article. So you have the prepare, and you have the assessment and action. Let me see here. It is the Everyone Project. That's right. That's what the Academy of Family Physicians calls it, the Everyone Project. So they have a couple of social determinants of health forms there. And then, of course, CMS has a screening tool that they use for it. So these are all, you know, really good approaches. And I think, again, that's a nice, brief, but concise and nice article on social determinants of health. So if you're looking for a place to go, there's a nice information there. So obviously there's a lot of information about resilience, and you know, I've looked at a lot of it myself, and sometimes I found it to be somewhat overwhelming, and there's sleep and nutrition and there's all these things, and you can find a lot of that in some of these resources that we've put out there. But I hope that taking a few minutes to just personally experience with me a moment of practicing some of these things was helpful to you today. So thanks so much for your participation and attention, and I'm going to open it up for questions.
Thank you, John. This is really helpful. Taking that moment was very helpful. As you said, just putting things down, even if it meant putting down the coffee cup. You loosen that clench on the handle, and already some relaxation can start. So think about your staff. Think about those you live with. Think about those who have been struggling through this last year. And let's talk about how these resources possibly could be helpful to your staff or your families, yourself. And let's ask John some questions, because I'm sure he has some answers. So we want to open it up to all of you now.
Let me just ask some of you, what kind of things do you do to take care of yourself? I mean, I'm sure people have sort of had to do that, and we do it in lots of different ways. Sometimes we do it through, sort of more spiritual ways. Some people do it through exercise, and, there's just lots of things we do. Some people do it through socializing. But let me ask you that, maybe you can share even in the chat, what are some of the ways that you have found that you've taken care of yourself? So we have somebody with mindfulness. Lots of ways of doing that. Walking, great. Even when it's 0, right? Yeah, we've definitely had some difficult days. Yoga, cuddling with the cats. Yeah, there you go. Pets can be very comforting. And the yoga is a great exercise, a great way of, sort of slowing down and being mindful as well. Morning exercise, 5 o'clock in the morning. Yep. Hot baths. There you go. And reading a good book. Yep. Uh-oh. Nancy, you got my sweet spot, dark chocolate.
I like the flip of instead of exercise, just call it movement. That's our colleague Jill, and I have actually taken her suggestion for that, and it makes it easier.
Yeah, I've certainly noticed that myself, especially with this sort of working from home and sitting in front of the computer all day long. And then in the evening, sometimes find yourself sitting. So yeah, moving, just getting up out of a chair and doing something is really important. We have a fishing alone. There's some mindfulness practice for sure.
Oh, somebody has a question.
Yeah.
Before you get to the question, you know what, John, I do have a question. Hi, it's Barb.
Hey, Bob.
Hi.
Good to see you.
Yeah, good to see you too. You did a wonderful presentation.
Oh, thanks.
I was just thinking of the one thing that happens to me with when you brought up the 0 temperatures. So consistency, the workday ends, I'd go out and take a little walk, even if it was just for 5-10 minutes, just to get out, get away from the computer, that kind of thing. But as soon as anything changes, I recently moved, the temperatures went down, it was a little harder for me to get out, boom, I just stopped, and I'm not consistent with that anymore. And I think I get very hard on myself, but I'm just trying to think of ways like, you just, I guess it's human nature, your pattern just breaks a little bit. It's certainly, with things we're dealing with COVID-19, life is in flux and things are just not the way they used to be. And I think humans just kind of go to, okay, I stopped that. Now I'm just, I didn't walk for 2 weeks, so now I just blew it and I'm not going to go back. I don't know, like reframing or something. What are your thoughts on that? When something comes up, how do you get back to taking care of yourself again?
Yeah, Barb, that's a great question. I've talked to people about that quite a bit. It's actually part of the process. And, I think I love your sort of awareness of it. That's great. And self-compassion, right? This is going to happen. Whether it's a day you just don't feel like it, or, maybe you're ill and not feeling well, so you break out of your pattern that way. It really doesn't matter. Not continuing on a regular basis is just, natural. Okay. The question though is, right, how do you get back to it? And you really are right there on the doorstep. First, be aware of it. Oh, I didn't do that. One of the other things that I like to try to remind myself of is, and I like doing it. I enjoy it, and I didn't do it. And today is an opportunity for me to do it again, right? And so simply that awareness that, oh, I didn't do that, or maybe I even haven't done it for several days. Okay, that awareness is my alarm that tells me, gee, I'm missing it because I enjoy it and I have an opportunity to do it today. And that's all that matters, right? So that's kind of the way that I address it is, I think our expectation that we're going to do it every day, is it kind of sets us up for that when we don't do it, we go like, oh, I blew it, right? And so what's the point, because I didn't meet my goal. Well, if our goal isn't to do it every day, it's just to do it as many times as we can, right? Because we enjoy it, then we can be a little more compassionate with ourselves and just say, gee, I haven't done that lately and I really like it. So you know what? I can do it today. Does that help?
Great, thank you. Yes, that was very helpful.
Thanks, Barb, for your question. John, we have another question from Tani or Tanny. What are ways to help a team or organization start to use practices for resilience while at work?
Yeah, great. I would encourage you to think about how you might incorporate a little bit of what we did today, Tani. If you noticed, I tried not to call it mindfulness. I tried not to make it a big formal thing. You don't even have to do all of them. You could just ask your team to stop for a minute, put down things that they're holding, take a deep breath. And thanks everybody for being here. Really appreciate that you get up every day, you come here with the intention to work together to help our patients or, whatever situation you're in. So, try to think about those really small, simple things you can do just to bring that team present in that moment today to refocus them, what are we here for? And, maybe encourage them to be, compassionate with themselves and with patients. You can actually use a lot of this with patients. I was thinking about that as, we were going through it. If you think about what are you seeing, hearing or feeling, I've actually noticed that even front desk folks that I've talked to sometimes will say to a patient, oh, what a pretty sweater you have on today. I really love those colors. What a nice thing. It's just a break, right? From what's your name? Who are you seeing? Instead of that kind of, they just take a moment to say, oh, that's so nice, and I think that makes a big difference, not only for a person, because it kind of breaks them out of it and it allows them to appreciate maybe that, yeah, this is my favorite jacket or sweater, right? but you're also practicing getting out of your sort of rote, constant, process to take a moment to notice somebody and enjoy it and appreciate it. And, that can be really great. So these things that we're doing can be great things to encourage staff to do. You could be a physician in an office, right? You do the same thing. You go in to see somebody and maybe, they're, wearing in fact, I saw this happen just the other day. Somebody was wearing a Brewers hat, right? And the person simply walked in and said, "Oh, Brewers, so baseball's starting up again, isn't it? I'm really excited about that." Tiny little moments like that, right? That really make a difference, both for the patient, and it gives you as a clinician or as, in whatever role you're in, a moment to sort of recognize, there's other things that are enjoyable and fun and important in our lives. And so we take that moment and then we can, follow up and go on and continue with, what we're there for, So, Tani, was that helpful to you, thinking about how to apply these things in those ways?
Yes, thank you very much.
Okay, great.
So I have a question for the folks attending today. Are you doing any of these things when you start off a team meeting? If you wanted to put that in the chat, or if you'd like to speak up, John's talking about some things that aren't necessarily new,
Right.
but also they are nicely organized in these areas and these tools that he's brought to us. Plus, he's done a great job explaining them for those who haven't tried this. But I'm wondering on the call, I'm sure there's a few managers, team leads that, perhaps do something like any of the things that we've talked about so far. If you'd like to chat those in or even open up and call them out verbally.
Yeah, Mary, as I think about Tani's question, just sort of doing maybe what I did, Tani, talking to the staff about how when they do those things, it's a nice thing for the patient or the person you're working with, but also enjoy it yourself because it's a moment for you. If you're asking them for their insurance card and they say, "Oh yeah, I've got it right here. Thank you so much. I appreciate that." Just a simple moment of gratitude. Just to notice that that's a good feeling. We're working together.
So in our chat, we have Angela shared that for our meetings, we usually start with everyone sharing a positive and then end with a 5-minute meditation. Several staff have apps on their phones that have provided good relaxation and breathing. Thanks, Angela. I'm curious, do any of those folks, or maybe initially, did anyone push back on that last 5-minute or meditation, or did anyone leave the group early?
Are you talking about for our meetings?
Yes, Angela, you had mentioned that, yes.
No one had any pushback. In fact, the first time we tried it, we kind of just did it as a trial, and every single person in the group suggested that we continue doing it.
Wonderful, great feedback. I know I have faked my family into it. They thought meditation was for other people, and they said, "I can never stay put that long. Are you kidding me?" So we tried it a few times, and it's been very helpful to them.
I was one of those people.
Good for you for trying it. Yeah, 5 minutes, you can get a lot done in 5 minutes, but you also can have 5 minutes go by very quickly too. That means that you really haven't lost too much of your time on the floor or in your practice. But that powerfulness of the feeling that you get afterwards will make the next 5 minutes go even better.
You know, one of the things I really like too, Angela, is that you had several staff sharing their own different apps and approaches to it. That's a great idea, you know, instead of like having one person or only the leader of the meeting do it, to, you know, to ask people, what do you do? You know, what do you guys have? And would you share that this morning with us so that we can all enjoy it? And we learn different things. In fact, right after you put that in, somebody put in that they love the Calm app. So, and I know that's one of them. I have an app called the Insight Timer, another really great app. And so it's really nice to kind of share those things and have the group share with each other, sort of what do they use to kind of help them with this.
We found a lot of things on YouTube. You can find meditation folks coming out, doing their own video, sharing it up on YouTube publicly. And then those are free. And there's a wide variety of things you can get. Some are not as attractive to me as others, as far as how they go about the meditation, but there are some very good quality ones out there as well.
Mary, this is Tony.
Yes.
I'd just like to put a plug in for some work that's just recently been done with Frontline Forces. We had another subject matter expert develop it's kind of a whole set of resources on it's caregiver well-being, but it can apply to anyone. And the focus was on nursing assistants, but again, it can apply to any manager, any individual working in any kind of healthcare setting. And so if you go to the Superior Health website and look for Frontline Forces, and maybe I can get that link in the chat.
Sure.
They aren't there yet. We're finishing them up, but Mia Croyle, who's the subject matter expert, did a series of 5 really, short. They're like 5 to 6 minutes. They're grounding, meditation, use of mantras, and they're really excellent that people might find helpful and useful.
Thanks, Tony. That's excellent. That's really helpful bringing that forward. All of you, on the call, you're part of our group. And that's what we do is we create resources and then we offer them back out to you. And also just kind of a second plug to that is as you have some needs, as you see resources out there that you'd like to explore further, but you're not finding the time to do that, don't hesitate to contact one of us at Superior Health, because we'd be happy to possibly take a look at those resources and then get back to you and the entire larger group. We see you all as the experts, and we see you all as our partners. So feel free to engage with us that way as well. Besides waiting, besides seeing our resource that we do send out. Thank you, Christine. Christine shared that Dr. Rick Hansen has some great books, materials, courses that folks can look for. So that would be Dr. Rick Hansen. Christine, do you happen to have a website by any chance that you could put in the chat? If not, that's okay. We can all do a little Google on that.
Yeah, Mary, I'd like to follow up on what Tony was saying about the resources that Mia did. I'm going to encourage people. There are lots of different paths, whether it's yoga, Tai Chi, mindfulness practice, mantras. There's lots of things. And the reason there's lots of things is because there's so many, we're so different. And each of us needs different things. And sometimes we need different things at different times in our lives. So I'll just share with you, an example of that from my own life. I'm typically a pretty physical person, enjoy activity. And so I started off doing Tai Chi. And that was one of the ways that I initially began practicing mindfulness, was through this movement, right? And I would joke with people when they would ask me if I did mindfulness practice and seated meditation. I'd say, I'm not ready for that yet. I still have to move. And sure enough, though, later in my life, I did get into seated meditation and mindfulness practice and really enjoyed it. but thought back often about how there was a time in my life I just didn't feel like I could sit like that I needed to be doing something. Yoga provides some of that same opportunity to be in your body and move and yet be mindful. So everybody's in different places. Everybody's going to find something that works for them at this particular time in their life, and that could change. I think one of the big things that I'd like to remind people about is that these things don't have to be big and long. As Tani said, just a few minutes at the beginning of the meeting, right? Something like that. So keep that in mind as you're playing with these things. So that one of my concerns is that sometimes they seem undoable because they're going to take whatever 15, 20 minutes or an hour, and it's like, oh, I don't have that much time. Well, we don't always need to have that much time. Sometimes a simple deep breath and a recognition of what's happening in this moment might help you just to calm down and manage that particular part of your day. So anyway, lots of paths. That's because we're all in different places at different times. So be compassionate with yourself and do what works for you.
Just want to let everyone know, Christine did put in Rick Hansen's website. It is in the chat, and she notes that it's very relatable, easy, and fun to listen to. And he incorporates the science with the art of mindfulness and resilience. So that's
that's great.
Yeah.
Thanks, Chris.
Thank you. Thanks for sharing. Nikki also put in the chat, that you could talk to us a little bit about what resources do you use to help your teams. Again, you can put that back in the chat. We still have a few minutes for questions for John or any other things you'd like to share today. In these moments of silence, we can also consider that some calm and possibly some mindfulness time.
Well, and I'll just take a moment to sort of go back to what Barb was talking about, how, our practice, whatever it is, might get interrupted. And, any of us who have looked into sort of the wisdom literature around this always talks about, the struggles on the path. That is a part of every tradition, that the path is not wide and clear and smooth and beautiful and easy. There's always going to be challenges and turns and things come up on whatever path you take. So it's important to not let those things stop us. Mm-hmm. But to, as Barb did, just simply notice it and recognize that I can continue on from wherever I am now.
Nikki has shared a great resource for kids. So I suggest you look at the chat for that. And I'd like to take this moment also to remind all of you that this is going to be, or this is recorded. So what we will do is we will place this out on our website, and you will be able to look at it in the area of past events, so that you can share this with your staff, as well as go back out and find the items that we have in the chat, because these will be great resources for you going forward. I'd also like to ask those who are still in the call with us, if you have any recommendations for future calls for us, as far as ideas of what you'd like to see us share around the area of COVID, because we certainly will take your suggestions. We really look towards what you're looking for to provide it back for you. The other thing I'd like to share with you is that our COVID calls, we call these the COVID calls on Thursday mornings, we have done a number of these, and all of these calls are out on our website, and they are available to you to listen to. And we've had many different types of COVID calls and from the beginning. And so each of the calls, you can kind of get a understanding of what they are before you get into them, so you could decide which ones you'd like to listen to. But there's some really excellent resources out there in them for you to continue your journey to work towards safety and compassionate care, as well as just taking good care of yourself through our time in COVID, which is still here. Any other questions? Well, I feel like we have come to the end then of our conversation this morning. Again, we really appreciate all of you attending, and we look forward to having more conversations together like these. And please go out and look at our website for the resources that we continue to build. This is ever growing. In the future, there's going to be even more access to resources, as well as we have some structured collaboratives going on. We're building affinity groups in the very near future around a variety of topics. And we wish you a great rest of your week and great health.
Yeah, thanks everybody. We really appreciate all you're doing out there. Take care of yourselves.
You know, we have one more question here, if we can just take this quick, which is great. So Janet, let's see, my screen is moving here. How do we remove guilt? We are healthcare givers, managers, feeling guilty, taking care of ourselves. How do we get beyond this? Excellent question, Jane.
So am I understanding, Jane, feeling guilty about taking care of yourself? Is that the question?
Care of self, and how do we get beyond this?
Yeah, you know, one of the things that I often ask people, Jane, working with them, because a lot of times people do give so much to other people and they're so used to that I have to just ask if they could try as best they could to do that for themselves a little bit as well, because you count too. And so I don't know if that will help you, but if we can just try to treat ourselves with the same kindness that we're treating others, it can be a big help to us. And the other thing you may have heard, which I used to use quite a bit, and I've heard other people begin to use it, is the whole old airplane thing. When the oxygen mask comes down, you know, if you don't get your oxygen on first, you're not going to be around to help anybody else with their oxygen, right? So I always remember that when I'm feeling guilty about, you know, taking care of myself, like, well, you know, if I don't do that, then I'm not going to be much help to anybody else. So hopefully that helps, but try to treat yourself at least equal to the way you're treating other people.
That's an excellent suggestion. Jane, you're doing so much for everyone. At the end of your day, I'm sure you're very tired. And even if you can find those 5 minutes at the end of your day, or just starting with yourself, start with yourself, build yourself up in the beginning of your day and taking breaks.
Chris makes a good comment. She says, you can't pour from an empty cup.
Yes, that's another excellent quote.
Thanks, Chris.
Nikki also shared one of her favorite quotes, which is, "You're no good to anyone else unless you care for yourself too," by Dr. Nenny.
Dr. Nenny, he was a physician friend of mine who actually passed away, but he was a colleague and a mentor as well. So
a lasting impression.
Yeah,
that's wonderful.
Definitely.
Yeah. All right. Well, I think we will, if no other questions come through, I think that John, if you wanted to stay on just for a few more moments, and we would like to conclude our call today. And we really thank you all for coming.
Thanks, everybody. Take care.